welcome to Tooth Be Told, where Kristin Linder, veterinarian and diplomate of the American Veterinary Dental College, chats with veterinary dentistry experts who spill the secrets behind the smiles. From practical tips to fun behind-the-scenes stories, this podcast is made for veterinary professionals with a passion for dentistry. Tooth Be Told, we can't wait for you to join us. Hi there, and welcome to Tooth Be Told, your inside look at the PerioVive training team. In each episode, we explore who we are, what we do, and the powerful role that hyaluronic acid plays in advancing patient care. Today, we're thrilled to have Candace Richards, a Veterinary Technician Specialist in Dentistry. Welcome, Candace. It's great to have you here.
Thank you. It's nice to be here. I appreciate your time.
Yeah, just to get started, tell us a little bit about yourself, your training, your current roles, etc.
Sure. So I'm a seasoned veterinary technician from the 1900s. I've been involved in veterinary medicine since the mid-90s. Right now, I live and work in Charleston, West Virginia. I graduated from Morehead State University and earned my registered veterinary technician license in 1999. And then I went on to get my VTS in dentistry in 2017. So I have always loved dentistry since I've been involved with the career of veterinary medicine for a few reasons. Every patient that we see, oral health impacts them in some way. So I fell in love with dentistry early in my career because oral health matters for every patient that we see. And it's an aspect of veterinary medicine where technicians can make a really huge impact. Veterinarians as a whole have to juggle all kinds of aspects of animal health. So if you can get an enthusiastic, knowledgeable technician in there to involve your clients with engagement and education, and then follow that up on the clinical side with quality cleanings and charting and imaging, then you can fill in those gaps for your veterinarian. And I really wanted to be that person. So that's what drove me to pursue my VTS in dentistry. And it's been a godsend. Focusing just on one aspect, dentistry in particular, I'm able to bring back advanced techniques, procedures, new products to my small animal general practice clinic and elevate our practice here. So it's better for every patient that I can bring the knowledge and just elevate us. And my doctors really appreciate it too, because most of them don't really love dentistry. I also enjoy dentistry because it's one of the few things that we can do where we see pretty immediate or at least quick results. There's not a lot of aspects to veterinary medicine where you see such a quick response. So that's pretty gratifying as well. So that's my main job. That's what I do mostly. I also spend a fair amount of time traveling to other clinics to share my knowledge through wet labs, lectures. I've partnered with some veterinary dental equipment manufacturers and product manufacturers to share that knowledge. So that's been pretty rewarding and a lot of fun for me. Having my VTS really afforded me these extra career options. It's allowed me to be an educator. More than that, though, it's made me part of a bigger community of dental nerds that I could not do without. So it definitely was worth my time and effort. Yeah.
I love that. Great answer. I think I share a lot of the same loves for dentistry as you. I love the instant gratification of it, the before and afters, and just helping our patients. And one of my favorite things was to always hear when you had one of those terrible mouths with periodontal disease and the owner maybe didn't know that their pet was in pain because they were still eating. And then they came back after extractions a couple of weeks later for the recheck, and they would always say, it's like they're a puppy again. And I just love that reaction. So
right. Yeah, that's something we can do. We can turn back time. Essentially, That's pretty powerful. Yeah.
Yes. And I think, we need technicians like you who are on the forefront of education because we just don't get enough. I didn't get enough in vet school until my residency, and our owners don't get enough education. It's just dentistry is really an emerging specialty, I think. And or just in general, I think it's an emerging topic. And we just need to hear more about it. We need to know more about it. We need to share more about it because of these cases where our pets are still eating. And so we think they're okay, but they're silently suffering. So yeah, well, great answer, Candace. You've got a great history there. So thank you for sharing about yourself. I hear that you have an article to share with us today. Do you want to give us a little breakdown? You can tell us the title and the author, and then briefly summarize the key purpose of the article for our listeners.
Yes. So the title of the article that I reviewed it's a long one. Healing of buccal gingival recession following treatment with coronally advanced flap alone or combined with a cross-linked hyaluronic acid gel, an experimental study in dogs. And it was performed by Yoshinori Shirataka and friends. So basically, the purpose of this piece was to determine whether or not adding cross-linked hyaluronic acid to oral surgery, and in this case specifically, it was coronary advanced flap surgery to repair a gingival recession defect, if that would improve the healing outcome versus just surgery alone. The researchers in this paper too were looking for meaningful response. And what I mean by that is they were measuring levels of new bone, ligament, and cementum.
All right. That sounds great. And so in this study, there was, just to summarize again, there was gingival recession, and they were performing a coronally advanced flap on these dogs to remedy that gingival recession and looking at the effect of hyaluronic acid there on one site, which brings me to my next question. What type of study design did they use, and why does this matter?
Yeah, I thought that was very cool. Aspect of this study in particular, they did, this was a study done in dogs, and it was a split mouth technique, which I thought was great. In this situation, one side of the dog was the control, and the other side was the testing site. So, like you mentioned earlier, they were checking for surgery to repair gingival recession. So on both sides of the mouth, they created gingival recession defects. They let those cook for a while, went back in, cleaned everything up. The control side just had advanced flap surgery to repair the defect. The testing side had surgery plus an application of hyaluronic acid. And so they were comparing the dog to the dog, which is great. That means to me that the outcomes that we're getting from this paper are based on the treatment, because the genetics, the healing times, the immune response, the behaviors, environment is the same for each side.
I love that. Yes. And I love that it's a split mouth study, so the patient is its own control. So it's a really nice, a clean study. With that said, what were some of the key findings that really stood out to you the most with this study?
Yes, I feel like the main takeaway was great news. It definitely proved without a doubt that adding hyaluronic acid to oral surgery, the flap surgery in this case, created more quality tissue regeneration. So let me explain that a little bit further. Both sides, surgery alone and surgery with hyaluronic acid, did heal per se, and they both gained to some level of tissue regeneration. But when they went further and looked histologically and measured probing depths and things like that, we got more meaningful healing on the hyaluronic acid side. For instance, just the surgery side alone, they did regain enough gingiva that they covered the defect, so the root was covered more. But when they looked histologically at the hyaluronic acid side, they found that they had, especially in the periodontal ligament aspect, more organized and meaningful tissue with more vascular aspects to it, and it was more functional overall.
Yeah, that sounds great. I read this study myself, and I think what was most meaningful for me was, just as you described, not only was there less gingival recession, obviously they performed that coronally advanced flap, but on the side where they applied the hyaluronic acid, there was, just as you said, more bone and more periodontal-like ligament fibers, those collagen fibers. And I think this is so important because it's not just a cosmetic change, right? We're actually providing that support for the tooth. So we're not just bringing that gingival tissue down, we're actually getting support for the tooth. We're getting that bone. We're able to restore that periodontium with the application of the hyaluronic acid, which is really neat.
It gives us more normal structure than, like you said, just cosmetics, which I think is pretty awesome.
Yes, I agree with you. Okay, well, anything else that you'd like to point out? Oh, why don't you tell us about, now that I'm thinking about it, the soft tissue healing aspect that they were able to show, just the difference in healing between the control site and the treatment site.
That's a good point to bring up, and I think you have some pictures to demonstrate this as well. And so the study gets into metrics. Like, they measured everything very thoroughly. And so we have the numbers to prove that, hyaluronic acid improves healing. But just looking at these recheck pictures that they provided in the study, you can just visually assess that the surgery side is more angry as it heals. It's more enlarged and bubbly. And at 2 weeks, the treated side is way more calm. It already looks like more normal tissue. I think what stands out to me a lot is that free gingiva even has that scallop edge coming back to it compared to its surgery counterpart. And then the final recheck, they're both healed, but just looking, the hyaluronic acid side is way more comfortable, way more normal looking tissue. You can't really even tell it had any surgery done. So it just goes back to hyaluronic acid and its biological properties, its antimicrobial effects, its support for bone, blood vessel formation. It increases a more comfortable, accelerated healing experience for our patients. So using it just makes sense.
I agree with you, which is why we're so grateful that we have you on our team to educate everybody on the process and on this product that we really feel so strongly about, and there's so much research behind. So thank you for sharing the paper with us today and the studies, the science behind it. I think that, is there anything else that you'd like to share today?
I don't think so. I appreciate this opportunity. Thank you so much.
Absolutely. Okay, Candace. Well, thank you so much for joining us today and for sharing your expertise. It's been a pleasure learning from you. And thank you to our listeners for tuning in to Tooth Be Told. If you're passionate about veterinary dentistry, don't forget to check out more episodes and resources on periovive.com. Take care, and we'll see you next time.